You just got to be aware. You got to be really safe and aware, and you got to pray that you're going to be safe when you go to work.
We are following up tonight on an audit done at a Kansas psychiatric hospital. In our last report, we revealed the safety and security concerns at the Osawatomie State Hospital, like lost keys and faulty alarm systems. Good evening, I'm Alyssa Jackson, and tonight KSHB 41 reporter Ryan Gamboa brings us the former employee who describes firsthand encounters with some of these dangers, plus what the state says they're doing to fix high turnover.
Safety and security concerns were outlined in a legislative audit at the Osawatomie State Hospital. One key takeaway, staff turnover rates. So I spoke with a former employee about why she left, and I do want to warn you that some of the topics discussed you might find troubling.
You got to pray that you're going to be safe when you go to work.
A year at the state hospital was enough for Jamie Rivas.
What was maybe your biggest concern about working there?
Being raped.
In 2015, the recent audit details when a patient sexually assaulted a staff member. That same year, the hospital lost its Medicare certification for repeated safety deficiencies.
It's the most dangerous position.
As a mental health technician, she worked directly with psychiatric patients, and there's no doubt it's dangerous.
There are always going to be inherent pieces related to the population that you're serving there.
Laura Howard is secretary for the Kansas Department for Aging and Disability Services.
Legislative post-audit shows us some things that we need to shore up and improve.
I submitted a Kansas Open Records request to see the full audit. In this survey, 2/3 who responded said patients made them feel unsafe, verbal, physical, even sexual harassment. The hospital's mental health technicians see an especially high and unreasonable turnover, almost as high as 80% last year.
That's true across the board at many facilities.
Historically, pay has been an issue.
We couldn't compete with fast food restaurants.
How much money is worth getting beat up all day?
Jamie Rivas says she made $22 an hour. Not enough. State lawmakers are addressing the issue of pay.
There's been 2 or 3 years of significant salary increases, particularly targeted to those positions. We also received the ability last year to offer different kinds of bonuses, hiring bonuses, retention bonuses.
Plus, in the hospital's response to the audit, leaders say it will implement new policies, procedures, and processes to ensure its staff's safety. And for Rivas, she saw enough to know she had enough.
If we had had the correct implementations and the correct plans and the correct care, then it wouldn't have been a bad place to work.
Ryan Gamboa, KSHB 41 News.